Mental health issues among pupils. A new web-based system to identify youngsters who need help will be rolled out at schools in Gauteng. Professor Jace Pillay from the University of Johannesburg is the project leader. He joins us now to tell us what it's all about. Prof, good evening, and thanks for your time. So you're using AI technology to deliver mental health services to children and youth. How exactly does the system do that?
Good evening to you and the viewers. What we've done is we've set up a system where we have online tests. So we have a battery of psychological and mental health tests, and it is also sophisticated that at a click of a button, it opens up and it takes the child who was filling that questionnaires straight into the website. And the data collects immediately on the cloud, and it's real-time data, and it's immediately accessible for us to conduct our research, to do the analysis, and to pick up the trends in terms of the mental health concerns that we have.
So does it diagnose a child?
The focus is not on diagnosis. The focus is more in terms of identifying symptoms with regard to particular psychological illnesses that we are used to. So it may pick up symptoms in terms of depression, anxiety, stress, trauma. And that's exactly what we have found in the last 5 or 6 years when we conducted research with orphans and vulnerable children. And that was the reason why we decided that we needed to look at an online system where we could get data in a more accessible way and even in a quicker way, and even in terms of volumes.
So it's mental health issues like that. You wouldn't be able to determine things like bipolar or autism or anything like that?
The test will be able to identify symptoms of that.
Okay.
And the tests that we do use, some of them are used for diagnosis purposes, but we're not using that for that purpose.
Okay.
Our focus is more in terms of identifying symptoms and to find out trends so that we'll be able to use the information in a way that we could provide support services. So the data that we collect will be able to be analyzed, and we could do a comparative analysis in terms of age, gender, race, cultural groups, and even localities, looking at which particular area, which particular schools seem to be present in more with certain mental problems like depression or anxiety.
So it's like having a school psychologist, basically, if they take the test.
It's more than that in a sense that the test will be able to pinpoint a lot of things that the child experiences. And what we're going to be doing also is that we'll be linking those tests to academic performance. So we'll be able to draw correlations to see whether certain illnesses, mental illnesses, kind of correlates with certain performances in terms of literacy and numeracy.
So from what age would a child be able to take these tests?
We're starting right now with the ages from 9 till about 17. And the reason for that is because we need to get more into the system, and the children will be able at that age to be able to complete the tests. With the younger children, we need to involve the parents and caregivers and the teachers. So that obviously involves another very tedious process. So as soon as we're able to refine our process, we will then get to the earlier stages of the child.
So do the tests vary depending on the ages, or is it a standard test that you use from age 9 to 17, or does it change according to the age, the questions?
The tests are standardized tests, and they focus on a particular age range. The tests that we used are very global tests, so that we could draw trends from global analysis. And these tests are also standardized on a South African population and even in the African population, and the culture fit test, so that we get very, very thorough and accurate findings from the test.
So you've piloted this already. How did that go?
We only launched our program today.
Oh, okay.
And because we launched it today, the pilot studies will now commence. We would have loved to have started the pilot now, but unfortunately, because schools are involved in examinations, we cannot get access into the schools.
So when can we expect a rollout throughout Gauteng then?
We are starting in January, and probably in the first 3 months, we'll have a significant amount of data that should be collected and we will have a clear understanding of some of the trends that we can pick up.
So, Prof, I suppose there are a lot of parents and teachers out there who go, it's all good and well that we find out what's wrong with the child, but the support that they get afterwards, or the right people to deal with this, will be just as vital. How do we ensure then that at the end of all of this, this has been worth it and the right help is on the other end for these?
Absolutely. What we will be doing in the system is that the system will link up with various service providers and different organizations in the community that provide psychosocial support. So what will happen is, from the test, we could actually pick up a child with specific suicidal tendencies. And immediately a red flag will show on the system to say that this child is having suicidal tendencies, and we are able to immediately link up with service providers to say that you can go to a particular school and work towards supporting that child at that particular level.
Fabulous. It's so necessary. I look forward to some feedback, I suppose, a couple of months into next year to see how this goes. And it's a great program. Thank you very much for your time, Professor Jace Pillay. He's from the University of Johannesburg, just talking about using AI technology to help kids and find out what's going on if they are battling with any mental health issues and how it's affecting their work at school as well.